Out of a busy schedule on a day which is very busy. I know there are a lot of events to cover. The reason that we have called you again here is because glaucoma, as you know, all the information was there in the video. You would understand that glaucoma can cause irreversible blindness, and it is the leading cause for irreversible blindness in the world. In the sense that if you get cataract, if you get a retinal disease, the vision can come back. But if you have glaucoma, the vision will never come back. So on the behalf of glaucoma department, I, Siddharth Dikshit, who is I am a consultant here in the glaucoma department, I thank you again. And I want to let you know that we are all dependent on you to raise awareness for a glaucoma examination. What will prevent this from happening, millions going blind without care, is just the request for a complete ocular examination. So we are taking some half an hour of your time, and we would request the same from the patient. So if they can go for a checkup and ask for a complete checkup of the eye and not just glasses, they can get glaucoma detected very, very early. And there are so many patients who have been following up for 20 years, they still don't have any symptoms. The great thing about early treatment is the patient can start doubting whether they actually have any disease or not. But that is what the power of early treatment is. There are very few diseases in the whole body which give you this opportunity. We are lucky that glaucoma does give you this opportunity. So the message that glaucoma is a blinding disease is spreading across. A lot of people are coming to know about it. But the positive thing that you can detect glaucoma very, very early and remain symptom-free throughout decades of your life also needs to be spread around. So the glaucoma, as you will find in the press release, is of many types. What we are very, very concerned about is small children getting glaucoma. Now, unfortunately, the kind of drops and tablets and syrups that is available over the counter in India is completely unregulated. And many times there are people in our rural areas everywhere, the north, east, west and south of India, who have not seen a single doctor till their late 50s when they need a surgery for something, but have taken medications, injections throughout on the recommendations of the pharmacist, and sometimes a person who is untrained, a shopkeeper who is sitting on a pharmacist's chair. So they know that steroids work like magic. Right? We all know Ben Johnson, 1987 100 meters champion, was on steroids, won the 100 meters championship, but later was banned. So steroids work wonders everywhere, especially for eye allergy, and it's a very commonly prescribed drug, but they can cause irreversible loss of vision in small children. Now, the difference between you, me, and small children is they are looking ahead at 60 years of life. If we get something, we are looking at 30, 40 years, but these children are looking at the next 70, 80 years of difficult life because of loss of vision. So our appeal is that any child who gets redness in the eye, allergy, should get a complete monitoring and should not use these wonder drugs across the counter. We also call for strong regulations by the government, the FDA-like body that we have here, the Comptroller General of the country, to bring in strict regulation to prevent sale of these kind of drugs. I would also like to invite Dr. Sirisha, our head of the department, to speak to you on the behalf of the glaucoma department. Dr. Sirisha, please.
Good morning and welcome to all. So we thought initially we'll have it on Friday, and since we preponed it to Thursday, that's why it's a little got a little delayed for us to get out of work. So Siddharth has briefed you about the use of steroids and how much of problem we have with that. And I think this is something that we are telling year after year, but unfortunately in our country we don't have any kind of a regulation. Ante ippudu mana desamlo ఓవర్ ద కౌంటర్ ప్రిస్క్రిప్షన్స్ ఇప్పుడు ఎవరన్నా ఒక పేపర్లో రాసి ఇచ్చినా, ఇప్పుడు ఎవరన్నా వచ్చి అడిగారనుకోండి, ఎక్కడో బయట ఒక షాపింగ్ మాల్లో చూస్తాం, ఒక ప్రాబ్లం ఉంది, ఈ మందులు ఆల్రెడీ వాడుకుంటున్నామండి, ఇది కంటిన్యూ చేయొచ్చు అని అడిగారంటే మీరు షాప్కి వెళ్ళి కొనుక్కోండి అని చెప్పారనుకోండి, 2 years ముందు ప్రిస్క్రిప్షన్ తీసుకెళ్ళినా కూడా వాళ్ళు ఇచ్చేస్తారు మనకు మందులు. సో డేట్ ప్రకారం అంటే ప్రిస్క్రిప్షన్ మెడికేషన్ అనేది ఇప్పుడు వేరే కంట్రీస్లో చూసారంటే వాళ్ళకి చాలా స్ట్రిక్ట్ రూల్స్ ఉంటాయన్నమాట. అంటే ఇప్పుడు 2017 ఇఫ్ దే హ్యావ్ ప్రిస్క్రైబ్డ్ ఎ మెడికేషన్ టు బి యూస్డ్ ఫర్ అ మంత్, ఇట్ కెన్ ఓన్లీ బీ యూస్డ్ ఫర్ దట్ 1 month. దాని తర్వాత సపోజ్ యూ గో బ్యాక్, వాళ్ళు ఇవ్వరు ఆ మందు. బట్ అన్ఫార్చునేట్లీ ఇన్ అవర్ కంట్రీ అలా ఏం లేదు. ఒక పేపర్ తీసుకుపోయి మనం షాప్లో చూపించామంటే వాళ్ళు ఎప్పుడైనా కూడా మనకు ఆ మందు అనేది చేతికి ఇచ్చేస్తారు. సో దట్ ఈస్ అన్ ఇష్యూ అండ్ ఐ థింక్ వీ నీడ్ టు బి వెరీ వెరీ కేర్ఫుల్ అబౌట్ ఇట్. ఐఎమ్ షూర్ వన్ డే వీ విల్ గెట్ దిస్ రూల్ that they cannot be prescribed just like that over the counter. So selling that medication is not wrong. Doctors only write it because it helps. But overusing it without monitoring by the doctor is a problem. So I think that message should go out very clearly. And the other important thing, what you have covered steroid-induced and family history of glaucoma. So glaucoma anedi, by now all of you are aware of what glaucoma is kadandi. Meeku dani gurinchi emana details kavala? గ్లాకోమా డిజీజ్ గురించి మనకు తెలుసు, బట్ దీనికి కొన్ని ఇప్పుడు ఈ ఇయర్ మనం ఫోకస్ చేయాలి అనుకునేది ఇప్పుడు 2 things వీ కెన్ ఫోకస్. వన్ ఇస్ చిల్డ్రన్ అండ్ ఓవర్ యూజ్ ఆఫ్ మెడికేషన్స్ అని మాట్లాడుకున్నాము. ఇంకొకటి ఏంటంటే ఫ్యామిలీ హిస్టరీ ఆఫ్ గ్లాకోమా ఉన్నవాడు. ఫస్ట్ ఆఫ్ ఆల్ గ్లాకోమా అంటే ఏంటని చాలామందికి తెలీదు. బట్ ఇఫ్ యూ సే అబౌట్ క్లోజ్ టు 1.1 crore people in our country are already having glaucoma, that many families, వాళ్ళ ఫ్యామిలీ మెంబర్స్ ఎవరైతే ఉన్నారో అంటే వాళ్ళ బ్రదర్స్ అండ్ సిస్టర్స్ యాజ్ వెల్ as their generations, their children, whoever is genetically 1.1 million. We will give you that printout, and in the printout that we are giving has all the statistics. So that many families, their generations are at risk. So what we want to convey is, first of all, diagnosing this condition is very difficult. ఒకసారి డయాగ్నోస్ అయిన తరువాత కనీసం వాళ్ళ ఓన్ ఫ్యామిలీ మెంబర్స్ చెకప్ చేయించుకున్నారంటే హూ ఆర్ అట్ హై రిస్క్, అట్లీస్ట్ దోస్ ఎర్లీ డిజీజెస్ వీ విల్ బీ ఏబుల్ టు పికప్ అండ్ ప్రివెంట్ దెమ్ ఫ్రమ్ గోయింగ్ బ్లైండ్. సో దట్స్ ద ఈజియెస్ట్ గ్రూప్ విచ్ వీ కెన్ టార్గెట్ సో దట్ వీ కెన్ హెల్ప్ దెమ్. ఇట్స్ లైక్ సేయింగ్ బ్లడ్ ప్రెషర్ ఎవరికైనా కూడా ఆఫ్టర్ 40 years అవర్ బ్లడ్ ప్రెషర్ ఆర్ బ్లడ్ షుగర్ మే గో అప్. Why do we say 40 years? There is no reason why we have a cutoff, because all lifestyle diseases or age-related diseases that usually happen at that until 40 they are usually okay, but after that there is a decline and hence we are likely to get those problems. Exactly the same way even for glaucoma there is a cutoff, but that is not a strict cutoff. Glaucoma can happen even if the patient is 2 years old or 5 years old, but the chances of getting glaucoma are high after 40. అలాగే వాళ్ళ ఫ్యామిలీ మెంబర్స్ ఎవరైతే ఉన్నారో వాళ్ళ పిల్లలు పెద్దవాళ్ళు, ఇప్పుడు 70 ఏళ్ళు అనుకోండి గ్లాకోమా పేషెంట్కి, వాళ్ళ చిల్డ్రన్ ఎవరైతే ఉన్నారో వాళ్ళు 35-40 years వచ్చింది అంటే వాళ్ళందరూ చెకప్ చేయించుకున్నారంటే నాట్ వన్స్ బట్ ఇయర్లీ, బికాస్ గ్లాకోమా ఈజ్ అగైన్ దే ఆర్ నాట్ రిలేటెడ్, బట్ జస్ట్ టు అండర్స్టాండ్ ఈజీ ఎగ్జాంపుల్ ఈజ్ లైక్ బ్లడ్ ప్రెషర్. టుడే వీ చెక్ బ్లడ్ ప్రెషర్ is under control. That does not mean మనకు బ్లడ్ ప్రెషర్ will never go up in the rest of our life. So once it is normal, it doesn't mean that it's going to be normal forever. You have to repeatedly check it up at least once in a year for that person's sake, to make sure that that person is not going to go blind. To have that checkup done is not going to be difficult. Same way even for glaucoma, their eye pressures may be normal now, but future lo peragachu. So yearly once routine ga vallu glaucoma checkup chepichukunnarante, to a significant proportion of these patients we can prevent them from going blind with this disease. Glaucoma undatam is not wrong. So if you don't detect glaucoma, if you don't treat glaucoma on time, that can lead to blindness. Glaucoma alone will not lead to blindness. It's like saying every person with a hypertension or diabetes will get a heart attack. No. If you don't treat that hypertension, if you don't treat those risk factors, ultimately it will lead to a serious problem that can take away life. Same way here it can take away eyesight, manam danni correct time lo gurtinchakapothe. So the request that we have for all of you is, because the only way we can reach to more people to create awareness is through media. There is no other way. మనం ఇక్కడ ఎంత మనం మొత్తుకున్నా మనం ఎంతమందితో మనం పిలిచి మాట్లాడినా we can reach to maybe about a few hundred and not more than that. But if it is on a newspaper, on a television channel and things like that, more people will be aware. And if at least అరే మా grandmotherకి glaucoma ఉంది, maybe I should get it checked up. Even if it hits about a few hundred people who can go and have it checked up, then I think we are doing our job. Okay, so family history ఉన్న వాళ్ళు కంపల్సరీ చెకప్ చేయించుకోవాలి. కళ్ళల్లో దెబ్బ తాకి ఎవరైనా ఇంజురీ, దేనివల్లనైనా ఇంజురీ అయింది అంటే వాళ్ళకి అట్లా హై రిస్క్ ఉంటుంది. హై మైనస్ పవర్, మయోపియా అంటారు, హై మైనస్ పవర్ ఉన్న వాళ్ళల్లో ఈ గ్లాకోమా వచ్చేదానికి ఛాన్సెస్ ఎక్కువ. సో ఏజ్ మోర్ దెన్ 40 years, హై మయోపియా, ప్రీవియస్ ఇంజరీ అయిన వాళ్ళు, plus children who already are having a problem either because of glaucoma itself or if they are using steroids for some reason for a chronic period, these are our high risk. There are several other conditions, we can go into those details, but I think even if these high risk people have it checked up routinely, it is very important. And when we were talking about steroids, it's not just the drops, but we have to understand in any form steroid, ante skin creams kanivandi, it's not uncommon. In the past 2 months I can tell you, at least I personally have operated 3 or 4 of girls who are in their age group of 15 to 16. So there is this one girl who was studying in a junior college, but because of whatever is the study, they have to keep awake and they are in a hostel, they don't take proper food and things like that. Kallu chuttute nalla ringulu vachayanamata. It's very common, aadapilla manaku kallu chuttute ringulu unnayi and people evaru chuste entamma ila undi ani. So she went and got a cream for these black circles to go away. She's been comfortably using it every night. రోజు రాత్రి పడుకునే ముందు మొహం కడుక్కొని ఆ క్రీమ్ రాసుకొని పడుకుంటుంది. ఒక 2-3 months కల్లా చూపు తగ్గటం మొదలెట్టింది. ఎందుకు చూపు తగ్గిందని వాళ్ళ పేరెంట్స్ హాస్టల్ నుంచి తీసుకొచ్చి చెకప్ చేయిస్తే ప్రెషర్స్ 2 కళ్ళల్లో 50కి పైన ఉన్నాయి. నార్మల్ ప్రెషర్ వచ్చి 10 to 20 కంటే పైన ఉండకూడదు. బట్ దిస్ గర్ల్ హ్యాడ్ అ ప్రెషర్ ఆఫ్ మోర్ దెన్ 50 అండ్ ఆల్రెడీ ద నర్వ్ ఇస్ డ్యామేజ్ 90%. Unfortunately, because of that skin cream that she was using only for the past 2 months, little bit of ointment and nalla idi povali ani. I mean, it is very sad to see that. And for the ippudu manam finally we treated her with medications could not help and we operated and we have controlled. It's come to a stage where that 10% or 15% of remaining vision we are trying to see if we can retain that for the rest of her life. She's only 15 or 16 years old. Imagine, not just for that girl but for the family. Like this, I am giving you an example. This is not at all uncommon for us. సో అందుకనే మనం కేర్ఫుల్గా ఉండాలి. పిల్లలకి ఎందుకు మనం జాగ్రత్తగా ఉండాలి అంటే, ఒకటి వాళ్ళకి తెలియదు, ఒకవేళ వాళ్ళకి తెలిస్తే వాళ్ళు వేసుకొని ఉండరు. పెద్దవాళ్ళకు తెలియదు, వాళ్ళకి ఏదైనా ప్రాబ్లం ఉందంటే వాళ్ళంతా వాళ్ళు చెకప్కి వెళ్ళలేరు. దే ఆర్ డిపెండెంట్ ఆన్ సంబడి. సో ఐ థింక్ ఇట్ ఈస్ అవర్ రెస్పాన్సిబిలిటీ టు టేక్ కేర్ ఆఫ్ అవర్ నెక్స్ట్ జనరేషన్ అండ్ మేక్ షూర్ దట్ దే డోంట్ లూజ్ దేర్ ఐసైట్ అన్నెసెసరీలీ ఫర్ సంథింగ్. ఇది పుట్టుకతోటి వచ్చిందంటే మనం దాన్ని మార్చలేము, బట్ ఇది మనం వీ కుడ్ 100% అవాయిడ్ ఇట్. సో వీ షుడ్ బి కేర్ఫుల్. సో స్కిన్ క్రీమ్స్ కానివ్వండి, ఆస్తమాకి యూస్ చేసే పఫ్ కానివ్వండి, ఆర్ ఎనీ అదర్ మెడికేషన్ ఇన్ ద ఫార్మ్ ఆఫ్ టాబ్లెట్ ఆల్సో, దే ఆర్ నాట్ బ్యాడ్. అగైన్ ఐఎమ్ సేయింగ్ దే ఆర్ నాట్ బ్యాడ్, బట్ అన్మానిటర్డ్. అండ్ ఏమవుతుంది, మన కొన్ని వాళ్ళే కదా అని చెప్పకూడదు. ఈవెన్ 1 month కూడా యూ కెన్ హ్యావ్ సీరియస్ సైడ్ ఎఫెక్ట్స్. సో ఈవెన్ అవర్ ఓన్ డర్మటాలజిస్ట్, అవర్ జనరల్ ఫిజిషియన్స్, చెస్ట్ ఫిజిషియన్స్, nephrologists, who are the people who use a lot of steroids for life-saving conditions, also are aware and they do refer, but not everybody does. So even the doctors community as well as people should be aware that we should try and avoid using these medications unnecessarily and unmonitored so that we can prevent this problem. Any other questions you have specifically? Steroid, why steroids causes?
The increased pressures in the
Eye.
eye,
Okay.
which leads to, I think,
Glaucoma, yes. So,
is there any research?
yeah.
It's only years.
Yes. So why it increases, it's very clear. It increases because there is eye lopala, there is fluid that is produced. So all of you are comfortable with Telugu or English? A mix of both. Okay. English is okay. So normally in our eye we have clear fluid that is called as aqueous humor, which is necessary for nutrition for the inside of the eye. So especially the cornea and the lens are two transparent structures. The cornea and lens have to be clear for us to see. If they are not clear, we can't see. So they are clear, and that nutrition is provided by this aqueous. So fluid is getting produced inside the eye on a constant level. That fluid drains through certain drainage channels which are present in the eye. Those drainage channels either can get blocked or they are not developed, or there are other problems that are there because of which this drainage itself is affected. So there are multiple reasons why this can happen, but ultimately it is because there is decreased drainage of the fluid from inside the eye. So the drops that we use to decrease the eye pressure work on different mechanisms. Konni medications వచ్చి pressure ని తగ్గించడానికి ఉత్పత్తిని తగ్గిస్తాయి. Production of the fluid can come down. Some medicines help to increase the outflow of the fluid. Fluid బయటికి వెళ్ళడానికి కొంచెం పెంచుతాయి. ఇవన్నీ కూడా హెల్ప్ చేయలేదు అంటే అల్టిమేట్లీ వీ డూ అ సర్జరీ లైక్ అ bypass surgery where we allow the fluid to drain out of the eye by creating a bypass. Since the drainage is not there or it is not working properly, we create an additional drainage for the fluid to drain. That is the surgery for glaucoma. Okay, so once the surgery is done, we create a drainage, but yes, it can. That's what I want to say, that surgery for glaucoma again is not, it's like a bypass surgery. You do a bypass, it doesn't mean that this person will be fine for the rest of their life. That also can get blocked at a future date. So even those who undergo a glaucoma surgery have to be on a follow-up for the rest of, to just make sure, is this working well for you? If it is working well, fantastic. If it not, then we may have to restart medications or may have to repeat the surgery. So they have to be on a follow-up even after the surgery is done, but the frequency of follow-up will obviously be less. Surgery అయిపోయి కంట్రోల్లో ఉంది అంటే we see them maybe once in 6 months, once in 1 year if everything is fine. But otherwise we may have to see them monthly or 2 monthly depending on how the problem is.
The numbers that you gave, the staggering numbers that you gave, why is it not mandatory on behalf of the government to ensure that everybody undergoes the glaucoma?
It should be mandatory.
Secondly, there are, you can take up issues like you have these optometrists and these glass people
Yeah.
who have these machines at their shops. So what they do is just to sell their glasses, they
Exactly.
just put a test in it.
Yeah.
People do not know what is
Correct.
glaucoma.
No, what you're raising is a very, very important one. As a small group of people, I don't think we can treat everybody across the country. It has to become a bigger level checkup and pick up of the disease. The difficulty is that glaucoma is not a simple problem. Just by checking the pressure, we may not be able to pick up all the glaucomas. It requires pressure checkup plus checking up of the nerve inside the eye, which is usually done by an expert. Okay, but what you said is very important, that at least screening can be done to a level. It's like checking blood pressure and then saying, okay, your blood pressure is up, please go and see the doctor. Something like that. At least to some extent we should be able to do it. There are a lot of initiatives to try and help this, but yes, we are at a very, very, very preliminary level. But I guess as we go by, more and more awareness if we create, then I think people will come forward to have a checkup done. Otherwise they shouldn't feel like anta nak baane undi kada, I'm fine, why should I waste a day and go to the doctor, is the general thing, right? మనకి ఎవరైనా చెప్పారు అనుకోండి, మీరు వెళ్ళి ఒకసారి అన్ని చెకప్ చేయించుకోండి, జనరల్ చెకప్ చేయించుకోండి అంటే అంత బాగానే ఉంది, టైం లేదు, it costs money, it costs time, so we are not aware of, we think like any other accident, it will never happen to us, so we don't take it seriously.
There are some reports about the cannabis being used. Is it right? I don't know. Sorry, I read it. For the prevention of glaucoma.
No. Marijuana, we don't want to tell it in front of the press, so we don't want it to be written in a way that, so marijuana, like one of the things that it can do also is decrease, it's a side effect, or you want to call it as, one of the effects is also to decrease the intraocular pressure. But they have so many other terrible effects that you don't even want to talk about it. Yeah. It's like saying alcohol decreases the risk of heart disease. So if everybody starts drinking, then we'll have more problem with the liver than the heart.
Only 2% of the world actually has recognized this as a drug. There are other reasons for promotion of the good effects of the drug. Don't you think? If 98% of the...
There was one person who come from Bangalore, so that is why I was just asking you how.
No, no denying probably the fact that it has this good effect, but there must be some reason that only 2 states in the entire 56 states of the United States actually recognize it. So only 2% of the doctors probably in the world use it, and there are more harms that can be associated than the benefits.
Thank you, sorry for
Yeah. So I would invite Dr. GC, who is our vice chair and has been working hard to take care of all the glaucoma patients for the past almost 30 years. So he will be able to give you a little more insight and maybe answer some of your queries as well. Beams, okay? So can we finish the talk and then you want to take photographs? So that మధ్యలో మనం డిస్టర్బ్ చేయకుండా. Is that okay with you? 2 minutes. Push.
So at the outset, thanks to all of you for helping us with the cause of creating awareness for glaucoma. The one of the ways of looking at this is that almost everybody in the room knows that there is a laser treatment with which you can remove your glasses. You know that there is a cataract surgery that can be done without injections, and there are so many developments in cataract and things like that. But nobody knows that there is a disease called glaucoma. When we go for a checkup, to answer one of the points that you were raising, when we go for a checkup, we don't have the time for even if the professional wants to do a complete examination, we just want to just take the glasses or take the drops and then run away. So if the awareness is there that there may be a blinding disease in the eye, that if it is not taken care of in time, I will lose sight, then we will invest that time. You go for a checkup once a year. And even in that time, when you go for a checkup once a year, you want to compromise and not spend a couple of hours so that you get a complete eye checkup done. So that attitude of complete eye checkup not being done, and the knowledge that there is a blinding disease that needs to be attended to, is an awareness that needs to be created. So you cannot cut corners when it comes to health. That is one point that I want to highlight. So creating that awareness that glaucoma is a disease is important. The second thought I would like to share as a reaction to probably what you said earlier, what you asked earlier, is can there be mandatory checkup for everybody? It is not possible, not done anywhere in the world, except for probably 1 or 2 countries, that a mandatory checkup is done for everybody. The reality of the situation is that across the world, even in the best developed countries, 50% of the people with glaucoma do not know that they have glaucoma. In the Indian context, it will be close to 90%. When we do the population surveys and we see thousands of people and evaluate their health, of the glaucoma patients that we pick up in the population, 90% of them do not know that they have a glaucoma. That percentage, even in the well-developed countries like Australia and US, would be 50%. So 50% of the people that have the disease, that are going blind, do not know that they have the problem. The second paradox for this kind of a thing is 50% of the people who have glaucoma have seen an eye care professional in the last 2 years, but their disease has not been picked up, either because the examination was not complete or because they were in a hurry and did not allow complete examination to be done. 50% of the people who have been told that they have glaucoma and they need treatment are not compliant with the treatment that they need to take. So that's another problem. So creating awareness that the disease is eminently treatable, but needs to be diagnosed in time. The diagnosis in time can happen only when we invest the resources of time and energy in getting the complete evaluation done. And once it is diagnosed, one of the things that I keep sharing with my patients is that it should become a lifelong kind of a friendship with the patient. Every 3 to 4 months, we'll have to keep checking their pressures. Every year, we'll have to keep doing tests to make sure that their vision is not decreasing. So that kind of a constant relationship has to develop. So unless the treatment given is correct, and even if the treatment given is correct, the treatment is not followed properly. You have to put drops 2 to 3 times a day for the rest of your life, and the patient does not feel that there is anything wrong with the eye because it is diagnosed early, then taking the treatment is kind of a burden for the patient. They don't understand. So for them to understand the seriousness of the disease and to follow up with the treatment is the other thing that is important. So creating awareness that we need to invest the time and resources for complete examination, and a general awareness that there is a blinding disease, that if we don't get the proper checkup done in the situation that Sirisha referred to, we may miss the disease and go blind. The problem of blindness in glaucoma, if everything is taken care of properly, occurs in less than 5% of blindness. The blindness occurs because the disease is not diagnosed in time, and 2, even if it is diagnosed in time, because of other priorities, the disease is not taken care of well by the patient. So if these 2 conditions are taken care of, glaucoma need not be a blinding disease, except for probably 2 or 5% patients where the disease is very severe. In spite of our best efforts, we are not able to control the blindness. So those are the messages that I would like to give, and if you have any specific questions for me, I'll take them.
How many patients do you come across in the city? Like how many people actually live in here? Everybody idea of the science?
So what we go by is, if you go by the population and say that about 20 to 30% are above the age of 40 years, of them 2 to 3% will be having glaucoma. So countrywide, if you take the number of people that have glaucoma with a population of 1.3 billion is about more than a crore. And of the more than a crore population with glaucoma in the country, estimated about 11 lakhs are blind. That statistic may be there in the handout that's given to you. So approximately 1% of the population will have glaucoma and 1% of them may be blind. Okay, any other questions? Thank you.